Good morning, I'm Jessica Lovell. Today, we bring you an encore presentation of one of our very favorite programs. This one focuses on Lynch syndrome that's caused by an inherited genetic mutation, and it increases your chances for certain types of cancers. Right now, our team is working hard behind the scenes to bring you more amazing stories when our live programming returns in September. However, if there's an urgent update from the health system, we'll be here to let you know first. Until then, please enjoy this encore presentation and make it a great day. Coming up today, cancer came as no surprise. The family history and genetic syndrome that put this survivor at high risk, plus the role of genetic counselors in cancer care. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Even if you live a perfectly healthy life and avoid every carcinogen known to man, sometimes cancer is just hereditary. We can be born with gene mutations passed down from our parents that greatly increase our odds of a diagnosis. Maybe you've heard of the BRCA mutation as they relate to breast cancer. Today we're focused on something similar called Lynch syndrome. It's one of the most common hereditary cancer syndromes, right up there with the BRCA gene. An estimated 1 out of every 279 people have it. So not super common, but not rare. It's caused by a DNA mutation on certain genes, and it increases the risk of developing several kinds of cancer. After watching what her dad and uncle went through, the woman you're about to hear from wasn't surprised by her cancer diagnosis.
That was his dog, Egypt, and his dog passed away a year before my dad did.
Lori Chavez wished her dad could have beat the family odds.
My uncle, who was my dad's youngest brother, he was diagnosed with colon cancer at 38. And my grandpa had a history of colon and prostate.
But she somehow knew it would be her turn.
I had trouble with my stomach. I've always felt it was a genetic thing. I have an older sister, 4 years older. She had previously been diagnosed. We knew that she had the Lynch gene.
And after testing, Lori learned that she also had Lynch syndrome, an inherited predisposition that puts carriers at a much higher risk of colon and other cancers. In 2018, she found out she too had colon cancer.
I wasn't surprised.
She came to the University of Kansas Cancer Center.
They removed my whole colon, so a total colonectomy, and then at the same time did the complete hysterectomy. I was done having kids. I was all for that. Like, I was okay with that. I could grasp that better than having my colon removed.
But Lori looks on the bright side of her diagnosis and treatment path.
I go a lot more frequently to the bathroom, and so I don't ever have those like really bloated days, or like I don't deal with constipation.
And she found peace through her personal loss and own diagnosis by helping to find answers. Last year, she entered a clinical trial.
I like to talk to people about it and like why I wanted to do the vaccine trial, because I watched all my kids at different stages, see different family members go through it. And it sucks for everybody.
Lori wants the loss of her grandfather, uncle, and now father to be a path to better outcomes for her own children and beyond. And we're so glad to have Lori Chavez here in the studio with us today. Good to see you again.
Hi, thank you.
Doing well?
Yes, doing good.
Good to have you back alongside Dr. AJ Banzel, a gastroenterologist and medical director of the GI Cancers Prevention Clinic at the University of Kansas Cancer Center. Good to see you.
My pleasure to be here.
We're going to learn about your research into the vaccine that we hope is going to help people living with Lynch syndrome. We also have Shabana Kubendran, a genetic counselor and manager of the genetic counseling services here at the University of Kansas Health System. Always good to have you.
Thank you.
Learning more about this as well. We're going to ask when it makes sense to go get tested and talk with a genetic counselor when you know that this is in your family history. So, Lori, before your cancer diagnosis, your sister had learned that she had Lynch syndrome. Why did she want to seek out a genetic test?
We just kind of had the suspicion with my grandpa and my uncle. When my uncle was sick, there wasn't a test yet, but his doctors at the Mayo Clinic really felt there was a genetic component to it. And so my aunt always kind of kept kept that in our thoughts. And so then she ended up being diagnosed with cervical cancer, and so she was offered the genetic test. And then with that, my dad was offered the test, which he had already had colon cancer, no genetic test at the time. And so that just confirmed that he had it, than my sister. So we're like 100% sure that my uncle also then probably would have tested positive as well.
We touched on it a little bit in your story, but what was that like, watching that kind of trickle down through your family?
It was hard because it was like you knew it was probably a genetic thing, but that was basically the extent of what we knew at the time. And so much has changed just in the last 10 years, like as far as being able to get the genetic testing to the extended family members, I think is a huge thing because it really impacts the entire family. My cousins have been tested, so it's just really been great to work with everybody here at KU because it's helped the whole entire family.
Well, and Shabana, how often do you hear like someone really knowing their family history
Absolutely.
and getting those tests and saying, I know something's going on here and I need to get tested?
Yeah, and that is one thing we specialize in. We see patients who have active cancer, and then we also get those that I would say about 50% of our referrals from external referrals are because I have a mutation that's running in the family and a genetic marker, and I'd like to get tested. So I'm glad you touched on that because that is a focus of our cancer center, is to do that what we call cascade testing, which is once somebody in the family has been identified, we want you to come to us so that we can ensure that we facilitate testing in extended family members.
So Lori, how long was it between learning that you had Lynch syndrome, that was determined, to then you learned you have colon cancer?
There was about 8.5 months in between. I happened to, when my sister was diagnosed and when she and my dad tested positive, I was actually pregnant with my youngest, and so they just didn't recommend waiting until after I had my son. So that way I feel was almost even harder, just waiting to deliver, waiting to, find out something I felt like I already knew. But yeah, there was about 9 months in there, and it was right at the beginning of COVID, and so that definitely played a part in, the time. I think it probably wouldn't quite have been as long of a.
So you get this, you find out you have Lynch syndrome, then you're pregnant, and then you have COVID. That does not seem fair. Dr. Bansal, so if somebody learns they have Lynch syndrome, how much does that really increase their risk of developing one of these types of cancers?
Yeah, that's a great question. So Lynch syndrome can increase the risk of cancer depending on the type of gene. It happens because of 4 main genes, and it can increase the risk of colon cancer up to 80%. To give you a sense how that compares to the general population, the risk of colon cancer in the general population is 4 to 5%, so it's tremendously increased. And then the risk of uterine cancer can be anywhere between 30 to 50% depending on the gene, which is less than 5% in the general population.
So estimated 1 in 279 people carry the mutation. So does that mean there's a lot of people who have Lynch syndrome but just don't know it yet?
And that's an excellent point, and that comes into Shobana's contribution earlier, that we should be making genetics testing more widely available. We estimate that perhaps 90 to 95% of patients who have Lynch syndrome do not know that they have it.
So Shabana, how is Lynch syndrome inherited?
Yeah, dominant. So 50-50. So we all have 2 copies of each gene. 1 copy of a gene comes from mom, 1 copy comes from dad. So we have 2 copies of every gene. And if 1 copy of the gene has the mutation, it increases your risk to have cancer. And then 50-50, which copy you pass on. So a flip of the coin with each pregnancy, whether you pass on the copy with the mutation or the one without. And that's how we provide counseling to families, that it's a 50-50 if you have it to pass it on. And then whether you choose to want to know whether you are in that 50-50 category where you inherited it. And then counseling, well, if you do inherit it, what are the screening recommendations that would come from GI?
So let's talk about Lori's children, because you have how many?
I have 3.
And your oldest,
My oldest
has tested?
Yes, he's an adult, so he has tested and he was negative. And then my 2 youngest, 10 and 6, so they'll just have to wait until they're 18. As far as I understand right now, they won't do it prior to.
So you wait until you're 18 to get the test?
Yeah, because Lynch syndrome is what we call an adult onset. cancer syndrome. There are colon cancer conditions that happen in children, but the one Lynch syndrome is particularly, we would say 18 to 25 is the recommended age, where you can come in and have the discussion of whether to get tested. And that's what I always want to emphasize. If you have something running in the family, don't think that you have to decide before you come to genetic counseling. Come to genetic counseling so that we can walk through what are the benefits and limitations of testing.
So one of the most concerning things, though, is that Lynch syndrome doesn't cause symptoms until you have cancer. Is that what I understand?
That is correct.
What do we do about early detection?
So that's why we have to talk to our families, know our family history, know the history of cancer in our family, and eventually I think with the changes in costs and healthcare, this might become universal, that we might perform universal genetic testing for timely diagnosis of Lynch. But the main clue right now is either personal history of cancer at a younger age or multiple family members with colon or other cancers.
So explain then just how important early detection intervention is for survivability.
So it makes a big difference. So multiple studies have shown that these cancers, if you are in part of a surveillance program, regular colonoscopies, then we can diagnose the cancer earlier. And for some of the cancers where we don't have great tools of screening, like ovarian cancer, even uterine cancer, where we can do prophylactic organ removal to completely reduce the risk of cancer down the road, which can save somebody's life.
Okay, so let's say somebody learns they have Lynch syndrome, but they don't have cancer yet. So let's say they just learn that they have it. What do they do with this information?
Exactly. So talk to your primary care doctor, talk to a local gastroenterologist, or talk to a local gynecologist who can initiate the testing and the surveillance program. So, for instance, at KU we have this high-risk program where you can approach us and we can have you navigate multiple healthcare approaches which we take in this situation.
All right, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. All of that information is there on your screen. So, Lori, you and your family, you met with a genetic counselor, is that correct?
Yes.
What was that like, so that folks who are watching and listening know what to expect?
For me, it was really easy because my sister, my dad had already met with her, and it was really great because my aunt saved all of my uncle's medical records, which she shared with my sister and my dad. And so when I met with, and it was Katie Nelson who I met with, when I met with her, she already knew all the information and kind of just re-educated me on some of the stuff that I had heard as a teenager, and, you know, kind of put it in perspective for me as an adult, how to handle things with my kids, even help have some of those, you know, facilitate some of those tough conversations that I had to have with the, you know, then young elementary school age child. But yeah, it definitely helped open some of those doors and just have somebody who understand the medical side, the family history side of it, but then also had walked so many other people through making those tough decisions, because I really wasn't sure what surgery I was going to choose at first, and it really took a few conversations for me to make that decision.
Well, and Shabana, as I hear Lori's story, I'm thinking, this woman walks into your door, she's like all teed up, she's got medical records and history, and an aunt who knows all the backstories, but what if someone just walks in and says, I don't know, I'm kind of the first point of contact, and I'm just trying to learn. Where do you begin, and how do you start sifting through that?
You're absolutely right. Some families have very small structure, limited family history. Even in those cases, we will provide counseling. Genetic counseling is not always about testing. It's about understanding your risk for a condition, be that cancer, developmental disorders. So if somebody says, I don't have this, but I have a concern because I heard something, we take that into context and provide a personalized risk estimate. What are the chances based on what we know? How can genetic testing help? So, you know, Dr. Bonsel's already talked about some of the universal screening programs that are already underway, like the All of Us study, where even if you don't have cancer, you can choose to have genetic testing to find out if you are at risk. Now, just because we find a mutation doesn't mean you'll automatically get cancer. We use the genetic information, combine it with your personal and family history, whatever we know, and give you a more personalized estimate. What are the chances this condition will develop for you? So even if you don't have your medical records, even if you don't have all your family history, come in with the information you have, and based on that we can provide like a range of what the chances might be for you to have that genetic condition, whether it's cancer or something else that you think is running in the family.
And Dr. Bensel, how nice is it to have someone like Lori go through genetic counseling before they come to you, and how much information are they able to then kind of set you up for success in managing this case?
That's a great point. I work very closely with genetics counselor at KU. First of all, they're wonderful people, well-trained, well-educated, and they really understand the genetics of cancer and many other disorders inside out. So how it helps me is that it can help the patient really understand what is happening with their diagnosis. And many of the patients who come to these clinics are stressed out and emotional, and the genetic counselor have been trained to how to provide that information to our patients. And this way, it's all mostly about education and understanding what to expect, because first of all, genetic diagnosis is not destiny, as Shobhana said. Once we know a diagnosis, we can do a lot of things to prevent cancer from happening in many different ways.
I want to talk about this clinical trial involving the vaccine. And just to clarify to the audience, this is still being researched.
Correct.
But what are you testing for with this vaccine?
Great point. So these are vaccines developed at the NCI by Dr. Jeffrey Schlom's group, a scientist who has been working on these vaccines for the past 40 years. He is now 84 years old, and finally the situation was ripe to test these vaccines in patients when they were ready for human use. So these vaccines are expected to train the immune system to generate these immune cells which can find these abnormal proteins in different organs in the precancerous cells, like a GPS system. And once they find those precancerous cells, the hope is that they will go in and destroy those cells in these different organs: colon, uterus, ovaries, breast, stomach, small bowel, and get rid of those cells before they turn into invasive cancer. So in this particular trial, this is the largest trial of vaccines in Lynch syndrome in North America, where we are enrolling approximately 200 patients, and half of them will get the vaccines, the other half will get saline injections. And then we will measure the number of cancers which occur and number of polyps at the end of 2 years.
And again, these are for participants who have been identified that have Lynch syndrome.
Correct.
Lori, we can't talk about the findings of the trial just yet, but what made you want to participate?
I just wanted to be a part of helping the next generation. I know my uncle used to say if he could just live long enough for science to catch up, you know, he would have been able to raise his kids. And so I just feel like that's the very least I could do with the information that I've gathered from him and my aunt and just the rest of the family. I feel like that's the least I can do.
And I know that totally delights you to hear that. What does it mean, though, to have what do trial participants mean for the work that you do?
Yeah.
Just how important are they? They're everything.
They are everything. They mean a lot, and I've seen these patients suffer firsthand. So I've been doing this for a while, and I really want to do something with the help of my collaborators at many institutions and all of the participants and the patients who are willing to to be part of this trial to make progress toward cancer prevention in this syndrome, which can increase the risk of multiple cancers.
Let's get to some questions from our viewers this morning, if we can. Stuart wants to know, how much does a genetic test cost?
Sure, good question. We get that a lot. So I always like to say genetic testing is covered by insurance. So if you have some form of insurance, most insurances, at least cancer genetic testing is almost always covered. Where the question comes in where somebody may not meet the medical insurance's criteria for coverage based on how many members you have affected in a family or how old you were. But even in those cases, don't let that put you off, because many genetic testing laboratories have financial payments and payment options that can limit the patient's out-of-pocket coverage. We always direct patients to laboratories to have that direct discussion, and we can provide you with information, vetted labs that will have that conversation with patients on what will that cost to them specifically. So we have one thing I do want to take a point to make in this section is if you just go Google, you will find many companies offering genetic testing. Not all of them are have results that are clinically validated or clinically actionable. So just because you get a report that says genetic test and it has, the name of the mutation doesn't mean it is. There are many different types of changes that you can find on a genetic test report, and that's where genetic counselors come in. We look through those genetic test reports in detail to see what finding is clinically significant, actionable, and what is what we would call variants of uncertain significance. I know that was not the question about cost, but it ties in because we are seeing, I'm almost using this as a public service announcement, because we're seeing a lot of patients who go and get direct-to-consumer testing, and that's very different than what we do clinically.
Well, no, and especially when it comes to the point of a lot of these 23andMe that are out there, and I mean, people give them as gifts and get a little snippet of information. And are you saying that maybe you get a little piece of information and then get it more verified?
Correct.
Take it to a more reliable source and
come
say,
to a genetic counselor.
Okay.
Don't stop there. Don't
stop there.
Exactly.
So you're saying it's somewhat reliable, but we want to dissect it a little bit more and make really understand.
It's just findings. I would say findings, red flags.
Okay.
Look here.
And then
then come see a genetic counselor or somebody who's had training in genetics to read that report and see what were the methods used to find that, and then maybe repeat testing in a diagnostic
So don't
lab.
ignore it, but take it further.
And Jessica, maybe we can ask Shobana to also comment on the cost of testing for the family members. The cascade testing is pretty critical.
Yeah,
do.
cascade testing, many laboratories will offer like a 60 to 90 day window where they will test relatives at no cost.
Like that. Okay.
Okay.
So someone like Lori comes in.
Yes. However, I also want to point out, just because there's a mutation running in the family, you can't ignore the other half of the family, other side of the family. So we may, when you have a mutation that's running in your family, one of the things to ask any provider that you're working with is, should I get tested only for that genetic marker? Or is there anything else in my family history, personal history, where I would actually merit for a larger panel? Because when we're talking about a mutation running in your family, like on your side, it was on your father's side. But what if your mom's side had a history of cancer?
Yeah.
So we can't ignore that. So when you see a genetic counselor, we're not focused on just facilitating and making sure we order the right mutation that's running in the family. We're taking your full family history, both sides of the family, to determine, is there anything else running on your other side of the family?
So you're not just checking for Lynch syndrome on her father's side. You're going to check everything
we're going to check.
on both
We
sides.
give them the option. So genetic counseling is always about presenting options to you. So if Lori had come to me and said, hey, this is running in my family, I'd say, Lori, great, this is what's running on your father's side. Tell me about your mom's side of the family. What other cancers could there be? And here are your options. Do you just want testing just for the mutation that we know of? Or do we see some red flags on this side where we would do a panel? Because one of the screening studies that Dr. Bonsall and I were just talking about, even for Lynch syndrome, many families don't meet that classic criteria. Many genetic cancer syndromes, you're not going to find just by family history alone.
Thank you for educating us on that. That's a really good, that's a very good, important point.
Sorry, I had a quick question. How often do the tests change? So if I was tested, say, 5 or 6 years ago, would there be a reason to then maybe redo a genetic test because so much?
So much has changed. Yeah,
Okay.
absolutely. So Katie would be happy to see you again and just kind of revisit if there are any updates. I don't recall offhand the panel or the test that you had, but based on any updates in the family history, that would be discussed. Typically, we would say after 3 years, just come back and have a conversation with a genetic counselor, or at least have your physician send a note to the genetic counselor saying, based on previous testing, has anything changed? And we typically do want updated medical and family history to be able to.
And if I may just qualify that, so the diagnosis, nothing will change with the genes linked to Lynch syndrome, but other genes may appear on the panel which may be of relevance.
Correct. Yeah.
Something may have changed. Such a great conversation. I'm glad we're bringing up these questions. Amy wants to know, are there other common genetic syndromes that Shobana and her team see?
Yes, and that is why we do panel-based testing, because not everybody would flag based on just the family history alone. But yes, colon cancer, there are cancer syndromes which can affect colon cancer affecting children. So familial adenomatous polyposis is a condition in which you can have colon cancer at a very early age. Others are conditions which you wouldn't necessarily think of as common, but do occur. Things like Peutz-Jeghers, where you have hyperpigmented macules. And another one, coming from a neurodevelopmental space, many may not think of the association between colon cancer and autism. So there are neurodevelopmental disorders in which you can have P10 genetic change, a gene change, in which it increases the chances to have autism as well as colon cancer. Again, not as high risk as Lynch syndrome, but when you take a full family history, we look at patterns other than just cancers running in the family. We look for other anomalies that can guide us to whether other syndromes could be running with colon cancer.
Jenny wants to know, do we know, Dr. Banzel, if there's any link between Lynch syndrome and this rise that we're seeing in young people in colon cancer?
Good question.
Great question. So there's a recent publication which looked at patients who were diagnosed with colon cancer younger than age 50, and approximately 25% of them had unknown diagnosis of Lynch syndrome. And when they had the cancer, they were tested and they had Lynch. So Lynch syndrome is one of the commonest explanations for cancers younger than the age of 50, but although it's also probably microbiome and diet and other factors.
All right, what do you want people to really take away today, Dr. Banzel, from this conversation?
I would say don't be afraid of genetic testing. So know your families, get along with the families, know the risk of cancer, or know the cancers which are running in the family, and talk to geneticists. And I believe you can find them through a website. I think if you're not close to KU, you can find them through a website to go to someone who's closest to you.
Don't be afraid to ask questions to your family. That's really good to know. Shabana, what's the big takeaway?
Think of a genetic counseling session where you can come to learn about the benefits and limitations of testing. I know many people, having to confront the possibility that you may be a genetic carrier and have an increased risk can be daunting and can put some people off. There are other, when it's not just about genetic testing, I always want to focus, we call it genetic counseling for a reason. The counseling aspect is understanding why somebody has this concern, assessing where is your risk perception coming from? How can we help you adapt to that risk? How can genetics help? Maybe there are other factors, mental health concerns, family dynamics. All of these things come into play in helping somebody decide whether they want to do genetic testing. And it's not just about giving the result, it's about how to help you adapt to living with that risk and taking control of something that has seemingly come out of nowhere because it's in your family. You're like, how can I control this? It's running in the family. So the counseling aspect is to empower people to feel in control of a circumstance where it was a 50-50 whether you got it or not.
Lori, what's the big takeaway from your story?
I too just want to push the genetic testing. Take advantage of being able to have all of that information at your disposal, basically, because without it, I've been through times where my mental health wasn't the best, and I might have skipped appointments, didn't, put things off, and knowing in the back of my head that I actually was a carrier, had the gene, kind of pushed me some of those days not to cancel that appointment, to do those follow-ups, and to make sure that I take care of myself for my kids.
Thank you for coming back to share more about your story. We really appreciate it.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.